Thanks for that, Crystal. Well, every February is Go Red for Women Month, and today is National Wear Red Day. Clearly, we're all in red. The whole team is here in Good Morning Jacksonville. So this is to promote awareness that cardiovascular disease is the leading cause of death for women. This is something that I'm learning new today. This is really important stuff here. So we have Amy Pollock of the Mayo Clinic, College of Medicine, and Executive Director of the First Coast American Heart Association, Jackie Easterling, with us this morning. We really appreciate you coming in. This is important stuff that I love to delve into because folks don't think about this. You have some really practical ways that we can protect our heart health.
No, thanks so much for having us
Of course.
here. And so I think very practically, a couple things. We want to know our numbers.
Yes.
We need to know our blood pressure, what our cholesterol is, if we have high blood sugars, and we need to know about our family history. It's such an important conversation to have with our loved ones. And so we need to understand what our risk is and then take steps to help lower our risk. So amazingly, about 80% of heart attacks can be prevented by simple things that we can do to help lower our risk.
You know, Amy, I'm glad we're getting into this because it's not something I stopped to think about really until I got a little older. I'm getting a little older, us women of a certain age here. But you have some really practical steps we can take. Even what we eat, it's so important.
Yes, so the Mediterranean diet. So I brought this. This is kind of some nuts and crispy chickpeas that are high in omega-3 fatty acids.
Yes.
It's just a quick salad topper. I make up something like this at home. I brought it for you.
I'll take it.
And then you just dump it on some lettuce. It is easy to go. High in protein, high in omega-3 fatty acids.
Yes.
So a really heart-healthy diet. And then making sure we get exercise, that we're prioritizing our health, getting out there and encouraging our loved ones to do the same thing.
It's easy to say, but so hard to do, but we have to. It needs to be done, right?
Absolutely.
You know, Jackie, we were talking about this, some of the events that you guys have planned throughout the month, but today is a special day. What's happening?
Yes, so today not only are we wearing red and watching the buildings all around town go red, we are kicking off our Women and Teen of Impact campaign. This campaign is a 9-week blind competition where people are spreading awareness about heart disease and raising life-saving funds. And then we come all together on May 15th at the Guidewell Florida Blue Conference Center to celebrate all the work that we've done together in the community.
It certainly is a celebration to spread the awareness. You bought some fun stuff. Brody, I have a headband for you, by the way. It's pretty snazzy. Oh, you're going to come try it on? And some pink shades as well. As I said, the whole crew is down. We're not playing around here. As I mentioned, Amy, Jackie, important stuff. What do people need to know about protecting themselves, their families when it comes to heart disease, cardiovascular?
Yeah, so I think just knowing what your risk factors are, making sure you're talking about your family history and that you're taking small steps.
Yes.
Just very practical things, even if it's just going out for 10 minutes. Grabbing a loved one and saying, hey, let's go out and go for a walk. Let's make sure we're lowering salt in our diet. Let's get an extra serving of vegetables. Yes. And making sure you're avoiding any tobacco.
Important stuff there. Brody, let's go for a walk, shall we? With your
all right, yeah, I gotta get.
And our chickpeas.
I know.
When I take my wife out for Valentine's Day, I'm wearing this.
Sounds like a plan. We'll see you guys later. 3 minutes or so?